Imagine being a parent of a little boy who is growing like a weed but hardly eating. Right after he does though, he is so unbearably full, and long afterward he won't eat much else. He always complains that his stomach really hurts and he even throws up periodically. Now, you can't figure out what is wrong with your child. You've been to so many doctors to check for maybe diabetes, reflux, and other countless conditions, and you just feel frustrated, you feel heartbroken, and really you feel helpless. And finally, then your child is diagnosed with gastroparesis. But now what? This is a scenario that we hear and see as pediatric and family chiropractors all the time. And the good news is that we can help. My name is Dr. Eric. I am one of the pediatric and prenatal and family wellness chiropractors here at ADIO Chiropractic, and we focus on pediatrics, prenatal, and whole family wellness in the Madison and Middleton area. And now, moms, if you've studied, you've Googled, and you've even tried everything pertaining to gut health, to supplementation, and nutritional remedies, this video is for you. One often looked factor though is in gastroparesis is that it can be caused by stress within the nervous system, especially the vagus nerve. The vagus nerve is a crucial part of regulating our immune system and lowering inflammation. And when it is functioning properly, this pathway is so powerful for our brain-gut connection and for our immune function and so much more. So let's dig in, and I promise you that you will be shocked by how much gastroparesis struggles are connected to other struggles that kids are experiencing on a daily basis. Now, before getting more in depth, please share this video with other moms and other parents who you know need to hear this message. We are on a mission to change this trajectory that our kids are on when it comes to their health. Just like Tucker. You know, Tucker now, before getting a little more into it, has his failure to thrive diagnosis has been removed. And at his pediatrician appointment recently, that he was on the growth chart for the first time since he was 2 years old. And this little guy had a tough time eating food ever since they really transitioned him to solids. And he was only able to really eat the same 5 foods over and over. Sound familiar? Right. Tucker's nervous system was in such a sensory overload that if he was presented foods like chicken or grapes, he would throw up right away. And his family was unable to really find the answer in therapies that they brought him to on a regular basis. And Tucker's family began researching more and more until they found hope in this Facebook video about what we call the perfect storm. And they signed up for our next workshop, and they knew that they had found the answer that they were looking for when it came to Tucker. Tucker's nervous system was stuck in this perfect storm that we talk about, and his family diligently just stuck to our doctor's recommendations and began seeing results quickly. They were only coming in for a couple of weeks before they really started to notice that Tucker, he really didn't have major reactions to the foods that used to really make him throw up with just seeing it. Furthermore, he was even able to actually eat some of those foods that used to make him throw up. And the therapies that Tucker frequently was doing for the last 2 years, they started to notice progression in that they had never seen with him before. And those practitioners supported chiropractic care so much that they actually released Tucker from the therapies because he didn't actually need them anymore. And that allowed his nervous system to really start to take control. And that is an exciting time for the whole family because less appointments each week, which means more time for fun with the family. And we are celebrating an incredible, huge win for this amazing family and kid, right? So let's dive into the science behind gastroparesis and all of this, right? So understanding gastroparesis, what is it, right? Gastroparesis is a rare condition where the stomach has this difficulty time entering or emptying the food within itself. And this condition can cause significant pain and discomfort for children. Now, some common indicators such as difficulty finishing meals, abdominal bloating and pain, and even nausea and vomiting and weight loss are actually some of the most recognizable symptoms that parents can see in these kids. Now, what are the causes of gastroparesis, right? Finding the cause actually can be a huge frustration for parents. Watching your child experience these symptoms is really just gut-wrenching, and traditional medical professionals don't quite know what causes gastroparesis. Now, a long-standing frustration with the traditional medical approach in these cases is that they only look to the gut, right? Your child may be referred to a professional like gastroenterologist who will only go after the digestive tract symptoms and treat those with medication, with surgery, or even surgically implanted devices to stimulate the stomach muscles. So that does it. And the results of these treatments are actually really just mixed at best. And one often looked factor is that gastroparesis can be caused by a nerve injury, including damage to the vagus nerve. The vagus nerve is a crucial part of regulating our immune system and lowering inflammation within the body. And when that vagus nerve is functioning properly, the vagus nerve actually tightens our stomach muscles to help move food through our digestive tract. And the cases of that, this is not the case in cases with gastroparesis, which then, is leaving the food not moving through, which is causing a lot of pain and discomfort. Now, some natural care for gastroparesis, as a pediatric chiropractor, our number one goal is always to dig into the root cause. To do this, we need to look at the entire nervous system. The gut is actually only part of that process, and really just a start at the very beginning. Nearly every single child that we've seen in our practice who is suffering from gastroparesis has a history that includes significant stress during maybe the prenatal period, or experience birth interventions or trauma that led to injury of the vagus nerve and the autonomic nervous system. And this trauma actually causes stress on the nervous system, leading to what we call subluxation and dysautonomia, and what we call more, just general term, the perfect storm. And benefits of neurologically-focused chiropractic care, really the first thing that we do to really help children who are struggling with gastroparesis is to schedule a consultation that dives deep into your child's case history and look at exactly the triggers and the root causes. Then from that, we combine this with an essential tool that we call the insight scanning technology. In about 10 to 15 minute exam, these scans can find, they can help measure, and they can help locate elements of subluxation within your child's autonomic nervous system. How awesome is that, right? These insight scans are they're very safe, they're non-invasive, and they are reliable. Then from that, we start to create a customized care plan that fits your child's exact needs and start to restore function and balance to the vagus nerve and overall to the nervous system as a whole. Once your child really starts their care plan with gentle, specific chiropractic adjustments that will release that stress and subluxation on the nervous system, then the vagus nerve will begin to operate at its full potential. And with the vagus nerve back online, your child's digestive tract will get back to doing what it was created to do in the first place, and that is help digest their food. And you will also see improvements in your child's sleep, in their energy, in their regulating emotions, in their immune system, and so many additional benefits to neurologically focused chiropractic care. Now, to close this video, first, please ask any questions that you have or leave a comment down below or send us a direct message, okay? Second, please share this video with other parents, other family members, or just Facebook groups who you know need to hear this information. Third, if you've tried the diets, the detox, the supplements, and still are looking for more, it's time to get the vagus nerve and the nervous system measured. It's easier than you think to. We use 3 main tests that we call them the insight scans, and these help us to quantify the stress on your kiddo's nervous system and how it is functioning with that stress on there. Finding this baseline and improving it makes all the difference in helping them conquer the gastroparesis and the associated really challenges that they are facing in conjunction. So give us a call at 608-824-0950 or send us a direct message, and we would love to schedule a consultation to learn more about your kid and what you can do and what we can do to help support your child in helping with gastroparesis.